All right, let's jump right in today. We're going deep on telemedicine apps.
Oh, interesting.
And specifically in emerging markets,
Right.
there's so much research out there on
Oh.
what's stopping people from using them, but
Hmm.
also what makes people stick around.
Yeah, what makes them loyal?
Totally, like what's the hook, you know?
That aha moment.
Exactly. And you sent over this fascinating study
Yeah, that's a good one.
from 2023, and it's from Technological Forecasting and Social Change.
It's a great journal.
Yeah. So they really dig into those barriers to adoption,
They really do.
but they also look at what makes people those super users.
Right. What makes them love it?
So are we ready to unpack all this?
Absolutely. Let's do it.
Okay, great. So the study, it kind of uses this framework
Okay.
called, have you heard of this innovation resistance theory?
Oh, yeah, it's a classic.
Yeah.
It's all about the psychology.
Right? Like, why are people hesitant?
Exactly. Like what makes people resist new things?
Okay, so for telemedicine, like, how does that actually play out?
Well, imagine, right? You're someone who's used to seeing a doctor face to face.
Yeah, the old school way.
Right.
Yeah.
And then suddenly you're supposed to, trust an app
Right.
with your health.
That's a big leap.
It is. It's a huge EE leap
Yeah.
for some people.
Yeah, for sure.
So, this theory kind of helps us understand
Okay.
why that feels so weird for some people.
I got it. So what were, like, some of the biggest barriers they found?
Okay, so the most prominent one,
Hmm.
they called it the usage barrier.
Barrier.
And it's all about how difficult people think it is to use the app. Not just
Like the tech, like downloading
not-
it.
right, not just being good with technology, but
Mm-hmm.
can I actually manage my health with this thing?
Right. So, like, using it effectively.
Exactly. So, can I book appointments?
Oh, okay.
Can I find my old records?
Mm-hmm.
What do I do if it's an emergency?
Yeah.
So it's not just about having the app. It's
Being comfortable.
feeling confident enough to actually use it.
For something so important.
Exactly, because it's your health.
Yeah, for sure.
Then you've got the value barrier.
Okay, I've heard of this one.
Yeah, and this one's all about...
But is it worth it?
Exactly. Is this really better?
Yeah.
Is it faster? Is it cheaper?
Then just going to the doctor.
Than how I've always done it.
Right.
And the study found, people are really concerned
About what?
about whether telemedicine really saves them time and money,
Okay.
and also whether they feel in control.
Of their health.
Yeah, when they're using these apps.
Yeah, it makes sense.
Do they feel like they're really managing things?
Yeah.
And, in emerging markets especially,
Right.
where, money can be tight,
Mm-hmm.
that perception of value,
It's huge.
it's absolutely critical.
Okay, so usage barrier, value barrier, what else?
All right, so the next one is the risk barrier.
Okay, this is a big one.
This one's kind of intuitive, right?
Yeah.
And healthcare it's personal.
Very.
So, of course, any risks
Yeah.
feel huge.
Yeah, they're amplified.
Exactly. And the study found anxieties around misdiagnosis.
Oh, I bet.
One participant actually said, how can a doctor diagnose me
Right.
without even touching me?
Right. Yeah.
There were also worries about, data privacy.
Oh, yeah.
And what if there's unexpected costs?
Mm-hmm. You don't want those surprise bills?
No one wants that.
Okay, so it's like you're handing over this piece of yourself
Mm-hmm.
to technology.
You are.
And if you don't feel totally secure,
Safe.
yeah, that hesitation makes sense.
It makes perfect sense.
Totally. Okay, so we got, what was it? Usage, value, risk.
Right.
What else did they find?
Oh, and then there's the tradition barrier.
Okay, I think I can guess what this is.
Yeah, this is about, breaking old habits.
Like, I'm used to doing it this way.
Exactly. So think about older generations. They're used to, going to the doctor's office.
Right.
So for them, telemedicine is
Totally different.
it's a huge shift.
That's a whole new world.
It really is for some people.
Yeah, okay. And then was there one more?
Yeah, one more big one.
Okay.
They called it the image barrier.
Image barrier.
And this one's about, how people perceive telemedicine.
Like, do they think it's legit?
Yeah. Do they really think it works?
Especially for serious stuff.
Exactly. They found, and some people were like, oh, it's fine for little things.
Right.
But if it's serious, I need to see a doctor
Yeah.
in person.
Face to face?
Yeah, face to face.
Wow. Okay, so we've got usage barriers, value barriers, risk barriers. prediction image. It sounds like telemedicine has a lot to overcome.
It does. It really does.
But, I mean, the study, it didn't just focus on the negative, right?
No, not at all.
Like, there were some positive takeaways, too, right?
Oh, absolutely.
Okay, so tell me about those.
And that's where things get really interesting.
All right, I like interesting.
Because they found this one thing
Okay.
that can overcome all these barriers.
What is it?
It's the power of trust.
Okay, hold on. Trust.
Powerful stuff.
Yeah, I mean, we all know trust is important, but
Yeah.
like, especially in these emerging markets where
Ah.
healthcare might not be as, I don't know, developed.
Yeah.
Like, paint me a picture. Why is trust so crucial here?
Okay, so imagine, right, you're in a place
Okay.
where healthcare is just, it's unreliable.
Oh, wow.
Or it's really hard to access.
like hard to get to.
Yeah, maybe the nearest clinic is miles away.
Okay.
Or, sometimes the care is good, sometimes it's not.
Just inconsistent.
Exactly. And then suddenly you have this app.
The telemedicine app.
Yeah, and it's like this lifeline
It's a solution.
to a big
A
problem.
huge EE problem.
Okay, so then trusting that app
Mm-hmm.
isn't just about convenience anymore.
No. It's like, it's about your well-being.
Yeah.
Potentially even survival.
You're putting your health,
In the app's hands.
in the hands of this technology.
That's a lot of trust.
It requires an immense amount of trust.
Yeah.
Trust in the app itself.
Mm-hmm.
Trust in the company that made it.
Yeah.
Trust in the doctors, the nurses, everyone you're interacting with.
So it's like in these markets,
Right.
trust goes from being a nice to have to like,
It's a requirement.
yeah, like you need to have it.
You need that trust to even consider using these apps.
That's really interesting.
It is.
And they found that when people do have that trust,
Yeah.
they're more willing to like,
To look past the risks.
yeah,
To be okay with the inconveniences.
to take that lead.
And embrace the potential of telemedicine.
So it is a leap of faith.
It is, but it's a leap that could,
lead to good things.
yeah, to major benefits.
Wow. Okay. So trust is the key.
It really is.
But how do these companies actually build that trust?
That's the million-dollar question.
Yeah. You can't just say, hey, trust us.
Right. It has to be more than that.
Like, what are some actual things they can do?
To win people over.
Yeah, to make people feel comfortable and confident.
That they can trust this app with their health.
Exactly.
It's a great question, and a lot of companies are trying to figure this out.
Yeah, it's a tough one.
It is, but one thing this research really highlights
Mm-hmm.
is transparency.
Oh, okay.
Like, people need to know
What do they need to know?
how their data is being used.
Okay.
And they need to feel confident that it's not being,
Shared.
shared.
Yeah.
Without their permission.
Okay, that's huge.
It is.
Especially in these, emerging markets
Right.
where maybe people aren't as familiar with, like,
Yeah, with digital stuff.
yeah, like data rights and all that.
Exactly. It's about making people feel,
In control.
yeah, like they're in control of their own information.
Yeah, that makes sense.
And beyond that, it's about the app itself.
Oh, okay.
Like, the experience of using it.
Like, is it easy to use?
Yeah. Like, think about the apps we use every day. Banking apps, social media, all that.
Mm-hmm.
They're easy to use. They look good.
It just makes sense.
Exactly.
Yeah.
Telemedicine apps need to be that good.
Especially for people who
Maybe aren't as tech savvy.
yeah, who aren't used to,
So using apps all the time.
yeah, exactly.
That's like that saying,
And
good design is invisible.
oh, yeah, I like that.
You don't want people.
They'll be fighting with the app.
Exactly. When what they really need
Is healthcare?
is to talk to a doctor
Yeah.
to get help.
Totally. Yeah.
And, we can't forget the human element here.
Right, because even though it's technology,
Yeah,
it's still about people.
it is. It's about connecting with real doctors and nurses.
Yeah, people you can trust.
Exactly. So building trust in those providers
Is still important.
is absolutely critical.
Okay, so it's not just about a fancy app.
No, it's about what happened.
When you open that app,
Yeah. And you connect with a doctor.
like that interaction needs to build trust.
It does. It really does.
Okay, so how do they do that?
Well, it's about communication, right? Like, can the doctor explain things clearly?
Mm-hmm.
Do they actually listen to you?
Yeah, like do they make you feel heard?
Exactly.
Yeah.
Like, you matter, even through a screen.
That's so important.
It is. And it's interesting.
What is it?
This study found that people can actually
Hmm.
develop brand love.
Brand love.
Yeah. For a telemedicine app.
Like they love the app.
Yeah. It's not just a tool for them.
Oh, okay. That's fascinating.
It is. It's like,
That healthcare is more than just,
yeah,
fixing symptoms.
it's about feeling cared for,
yeah.
supported. Like, you can manage your own health.
Okay. So you're saying that an app
Mhm.
can actually tap into that.
Yeah, it can.
Yeah.
It's about exceeding expectations.
Okay.
So when an app goes above and beyond
Mm-hmm.
in terms of how it works,
Mm-hmm.
how it looks, the whole experience,
Yeah.
it creates this positive feeling.
Like a good feeling.
Yeah, like when a company just gets you.
Oh, like they understand
Exactly, like they know what you need.
before you even ask.
Yeah, and it feels good.
It does. It does.
So it's not just about, doing the bare minimum.
Right.
It's about delighting people
Give me an example. Like, what could an app do?
to create that brand love.
Yeah.
Well, think about personalization.
Okay.
Imagine an app that remembers your preferences,
Okay.
curates content just for you.
Based on, like, your health stuff.
Exactly.
Yeah.
And even reminds you to schedule appointments
Oh, that's handy.
or to refill your prescriptions.
Like a personal assistant.
Yeah, but for your health.
I like that.
So it feels less transactional
Yeah, less like a one-time thing.
and more like an ongoing relationship.
Okay, that makes sense.
It could even be something as simple as
What?
offering support that goes beyond just,
Technical stuff.
exactly, like fixing glitches in the app.
Yeah.
Maybe they give you access to educational resources
Oh.
or connect you with support groups
Mhm.
or even offer discounts on, healthy living stuff.
So they're thinking about the whole you.
Exactly. Not just the immediate health problem.
That's cool.
So it's like they're saying, hey, we're here for you.
Yeah, not just for the appointment.
Exactly. We care about you long term.
I like that a lot, but,
Yeah.
we can't forget about the business side of this.
Right, because all this brand love sounds great.
But, like,
Yeah.
does it actually help these companies?
That's a good question.
Like, is it just a feel-good thing, or...
Does it impact their bottom line?
Yeah, exactly.
And that's where continuance intention comes in.
Continuance intention.
Yeah, it's a fancy way of saying,
Okay.
will people keep using the app?
Oh, okay, got it.
And the study found a strong link between brand love
Mm-hmm.
and people sticking with the app.
So if they love the app,
They're more likely to keep using it,
and less likely to, like...
to switch to a competitor.
Yeah, yeah.
And they might even tell their friends about it.
Word of mouth.
Exactly. And, especially in communities where trust is so important,
Yeah.
word of mouth is huge.
It can make or break a company.
It really can.
So basically, if you build brand love,
You build a loyal customer base.
and that leads to...
Sustainable growth.
Okay, and then the company can keep growing and innovating.
Exactly. They can offer even better services, reach more people.
So it's a win-win.
It really is for everyone involved.
Okay, so we've talked about the barriers,
Yeah.
the trust thing, and this whole brand love concept.
A lot of information.
I know, but I'm always curious about the,
The so what?
yeah. Like, what does this all mean for the person listening right now?
That's a great question.
Like, if someone's thinking about trying telemedicine, what's the takeaway for them?
I think the biggest takeaway is don't just,
Jump in.
don't just pick the first telemedicine app you see.
Right.
Take your time,
Do your research.
Exactly. Find one that you really
Connect with.
connect with. It's kind of like dating, right?
Oh, that's a good analogy.
You wouldn't just marry the first person you meet.
No, definitely not.
You want to find someone who,
Who gets you?
who share your values, who makes you feel comfortable.
Yeah, safe.
Exactly. So do your research with these apps.
Read those reviews.
Talk to people, ask questions,
Yeah, get the inside scoop.
and look for an app that, not only has the services you need,
Yeah, the practical stuff.
but also it just feels right.
Like a good fit.
Yeah, for you, for your lifestyle, for your tech comfort level.
And remember, trust is key.
Oh, absolutely.
So look for those signs.
Yeah, like are they upfront about how they use your data?
Mm-hmm.
Are the doctors, are they actually qualified?
Yeah, do they have experience?
Are people happy with the care they're getting?
Yeah, are there good outcomes?
You can usually find that information online.
Yeah, reviews, testimonials.
And don't be afraid to try different apps,
Oh, yeah.
just because one doesn't work for you.
Doesn't mean they all won't.
Exactly. Telemedicine might still be a good option.
It's like finding a gym.
Or the right pair of shoes.
Yeah. It might take a few tries.
But when you find the right one,
it makes a difference.
a huge difference.
Okay, so we've talked about the barriers, the trust, the brand love.
Hmm.
But I want to end on a positive note.
Oh, yeah?
What if we could rethink healthcare completely?
Ooh, I like where this is going.
Like, what if it wasn't just about,
Being sick.
yeah, treating illness, but it was more about,
About well-being.
yeah, like thriving.
Exactly, like feeling your best.
And what if technology could actually help us do that?
I love this.
Like, instead of being a barrier, it was a bridge.
To better health.
Yeah, to the care we need.
Exactly. When we need it, wherever we are.
Like, what if these apps became our,
Our partners in health,
Yeah, helping us stay healthy.
keeping us on track with checkups, managing chronic conditions.
And even like mental health support.
Absolutely. It's all connected.
I mean, we're already seeing some of that.
We are.
Like apps with personalized coaching, virtual support groups.
Even AI that helps us understand our own health data.
That's so cool.
It is. It's about giving people the power
To take control.
to manage their own well-being.
That's a powerful thing.
It really is.
So as we wrap up this deep dive
On telemedicine.
in these emerging markets,
Mm-hmm.
I'm feeling pretty optimistic.
Oh, me too.
I mean, there are challenges for sure,
There always are.
but the potential is huge.
It's massive. We could really change things.
Yeah, improve healthcare for so many people.
Exactly. It all comes down to trust
Yeah, building those connections.
and creating experiences that really matter to people.
And when we do that,
The possibilities are endless.
so true. Well, thanks for joining us on this journey.
It's been a pleasure.
We hope you learned something new.
And maybe even feel inspired.
Yeah, to explore the world of telemedicine.
It's a fascinating world out there.
Until next time, stay curious, stay informed, and stay well.